let's return to our top story. The coronavirus is exposing cracks in health systems in countries around the world, including the United States, where there are growing concerns that the high cost of healthcare could prevent people from undergoing testing or seeking the medical aid that they need. Let's talk now to Dr. Gavin Yamey, who's former advisor to the WHO and currently director of the Centre for Policy Impact in Global Health at Duke University in the United States. Thank you for coming in. I know you have a lot of experience around the globe, but I want to focus on the US health system because it is very expensive to get health cover. It can be expensive, I suppose, just getting a test.
It's very expensive, and that's even if you have insurance. So about 2/3 of the population has insurance, mostly private insurance through their employer. But that doesn't protect you from medical costs. Look, I have fantastic health insurance. I'm a professor at Duke University. And I still have to pay when I go and see a doctor. I have to pay what's called a copay. It may not be that large, but if you go to a clinic, if you see a specialist, if you have to have any kind of procedure, it can be hundreds of dollars. Even people with health insurance in the States pay on average $1,300 a year. And we saw what happened. There was a patient from Miami. He had been in China. He came home. He had a fever, flu-like symptoms, and he did absolutely the right thing. He went to a local hospital in Miami. He got tested for the coronavirus that's causing COVID-19. Fortunately, he didn't have it. He had regular influenza, and he got a bill. His bill was $3,250. His insurance said we would pay half, but that still left him with almost $1,500 out of pocket. And don't forget, there's around 27 million people with no insurance at all. Trump has pushed 7 million people off insurance. So, you know, at the end of Obama's second term, with the Affordable Care Act, known as Obamacare, the insurance rate had increased and there were about 20 million people uninsured. That's now 27 million. They would be paying that entire $3,250. And what I'm deeply worried about is that those sorts of costs are stopping people with symptoms from going to see a health provider and getting tested. And they need testing if they have the illness, obviously, to have treatment. And then those around them who may have come into contact, we need to reach them as well. So it's an impediment. This is a patchwork system with giant holes that are getting in the way, paradoxically, of one of the richest countries in the world tackling the coronavirus.
So that is a really big issue about whether you think you can afford it, even in going to your primary care provider, your GP. Now, another issue is if you feel sick, you think you might have the coronavirus, you may even have been tested positive, can you afford not to go to work?
So, another of the great paradoxes, I mean, I live in the States, I live in North Carolina. One of the great paradoxes of living there is it has some of the most remarkable healthcare in the world. But in addition to these giant gaps in health insurance that I talked about, it is the only rich country that does not guarantee sick pay if you're unwell. And so for low-income Americans, they can't afford, if they have symptoms, to stay off work. We know that during swine flu, for example, in 2009, 3 out of 10 workers with symptoms actually went to work, and they infected an additional 7 million people. So I'm very worried that what you're going to see in the United States with coronavirus is this division along lines of privilege, where the poor who don't have health insurance and who can't afford to take time off work are going to suffer the most. We know that people on a kind of low income, on low wage, they're likely to be interacting with the public a lot. They're our carers in care homes. They're our teachers. They are our school dinner ladies. They're our bus drivers. They earn, on average, $10 an hour. And if they're sick, you know, they're not going to get any sick pay. And so that's a sort of a double jeopardy, the lack of health insurance and the fact that there's no mandatory sick pay if you do get sick.
And just having lived in the States myself for quite a long period of time, raising these issues is sometimes seen as unpatriotic.
That's right. I mean, it's interesting, as you can tell.
Is it hard to have that debate in the States?
You know, I was trained in the National Health Service, my first love, and I will go to my deathbed believing passionately in the British National Health Service. But talking about single-payer healthcare, talking about everybody getting health insurance, with the rich subsidising the poor, the healthy subsidising the sick, which is really what the NHS does. It's a very beautiful communal vision. It's not easy to raise those issues in the United States. It's, you know, perhaps a bit more of an individual kind of sense that, you know, those who pay for health insurance, you should look after yourself, you should buy your own health insurance. And why is it up to me to, you know, buy health insurance for others? Now, I happen to think that this is an astonishingly clarifying moment for the American healthcare debate. Because even if you absolutely believe that, passionately, you know, to your core, that only the rich should be able to buy their health insurance, at this moment in time, can't you see that it's very good for you that everybody is covered?
That herd immunity.
Exactly.
And
you're
Gavin,
going to get...
we have to leave it there. I think we should pick up this debate because it's a political debate that will factor more and more this year. Gavin Yamey, thank you very much for joining us.
Thanks for having me.